Hey guys, today I want to tell you about me, my arm, my money, and my trip to the emergency room. I got a little infection in my arm the other day. It happened, it was a little infection. It was like a pimple or an ingrown hair or something, what it looked like. And it started to get infected. It looked swelling. It was round. It was about the size of a quarter. But I didn't pay too much attention to that. You get bit by bugs here a lot. The next day, it was a little bit bigger. And when I took a shower in the morning, it started to bleed. Well, Janet, she fixed it all up, put some ointment on it, put a Band-Aid on it, and I went out about my business. That afternoon, when I got home, my arm was really swollen and it was sore. It was tight. It was red and shiny. And I'll try to show you a couple pictures here I took of it after the fact, because taking a picture for YouTube was not top priority at the time. So I told Janet, we need to go to the hospital. So we drove down to Sillimont Hospital. As we're driving down to the hospital, Janet calls our doctor. And the doctor receptionist answers, she's not there, but we're close. So I decided we're going to go to the doctor's office anyway. Maybe she can recommend somebody take a look at my arm. Maybe the nurse can just take a quick look at it. When we got there, no way. The doctor was gone. The receptionist couldn't do anything. Told us to go to the OPD. I had no idea what the OPD was. And she told us to go down by the emergency room to the OPD. So our doctor's office is right next to Sillimont. So a minute walk to the main entrance to the hospital. We asked the guard, where is the OPD? I didn't know what it was. I'd never been in the emergency room before. Thank God I've never used nothing in the hospital other than to get a wellness check, that annual physical that I do. And he pointed to the emergency room. So we walked over to the emergency room, talked to the next security guard. He pointed us to a door. We walked in that door, and there were about 4 or 5 people sitting in the chairs, not looking too good. And there were some people on gurneys right outside the door. The nurse came over to us, had us fill out an information card. It had our phone number, our address, my name. She took a look at it. And after she got all the paperwork done, they sent us to the OPD, which is outpatient department inside the hospital. And in this area, there were about 15 people waiting. They told me to sit there and wait. It was an OBGYN also. A lot of these people that were there were pregnant women. And it took time to be our turn. But in the meantime, a couple intern nurses or intern doctors or whatever these medical professionals' title was, they came out to get more information, took a look at the swelling, asked me if it was a bug bite. Did I cut it? I told them I didn't know. They also asked me if I did any drinking. Was I a smoker? They started doing all the normal questions that get asked in a doctor's office. Well, we sat there for about another half hour. So far, nobody has approached me about money, how much it cost, what are we going to pay. And remember, Sillimont is a private hospital. This is a hospital for profit. So we're sitting there. Finally, we get called in to the office. We sit down, fill out a little bit more information. And they want to know if I was on record at the hospital, which I was because of the physicals I've had done there. And the nurse took a good look at it. And then they gave me a prescription. And they also gave me a piece of paper to take to the cashier. So Janet and I walked over to the cashier to pay for this. And I said, do you take PhilHealth? And to my surprise, they said no. And what it was, the bill came out to 1,030 pesos. Guys, I want you to pay attention to the cost of things as we go through here. And what that covered was some blood work. That was going to draw some blood. But before we did that, Janet and I walked over to the pharmacy. When we were in the outpatient department, they said we have to go get our own medicine. And I've heard about that many times here in the Philippines. Always take somebody with you. And that person would go to the pharmacy and get whatever you need. So we go into the pharmacy. We give them the prescription. And the lady comes out with a bag of ice. And then she puts the ice in a plastic bag, seals up the plastic bag, and then tapes my medicine to the ice pack. and then puts it in a paper bag. They got to keep it cold. I don't know what the medicine is. I don't know what it's for yet. We walk back into the hospital. We walk into the laboratory, and we go into the laboratory, and I go, I give them the paperwork. They give me a ticket. I'm number 17. While we're waiting, the bag is getting all wet from this melted ice. Janet's getting really worried about this. It is just, the paper bag is totally shot. I walk up to the little reception area there in the lab. I said, hey, my medicine, the ice is melting. I need to get this blood work done, draw the blood so you can check on it for me. She calls the lab tech who is going to draw the blood, and they call number 11 and then number 12, and we're number 17. Janet says, let's just go. We walk back to the outpatient department, and we go in there with this medication. Now, what happened to me was when this was bleeding and I was out and about, it's happened before. And it happened when we were up in Cebu. I had a little cut here in the same area, and it swelled up while we were in Cebu. And when we came back to Dumaguete, after about a week, it went away. And I was worried about it, but not as worried as this time. This time it was in the exact same area. But, you have right along here, there's where a vein goes or an artery. That started to swell up. And I started to worry about sepsis. I started worrying about the infection getting into my blood system. So I was more concerned about this than anything else. I was concerned about the infection spreading, if that's what it was. So we go, while we're in the OPD, the guy takes the medicine out, and he's going to give me 2 shots, one in the left arm, one in the right arm. As he gives me the shot, I ask him, what is that? He goes, that's a tetanus shot. Then when he goes to the right arm, he gives me an antibiotic shot. Now, we had the fee already of 1,030 pesos for the blood work. That went to the hospital and the lab. This time, with the prescription, and when we went to get the medicine, this is the tetanus shot medicine and the antibiotics medicine for a shot. That was 1,970 pesos. Right now, we're at 3,000 pesos for this emergency room visit. He gives me the shots. And then before we go any further, the doctor's in the other office. The doctor goes, the consultation fee is 700 pesos. And I said, no problem. This guy fills me out a bill, and he tells me to go take it to the cashier. And this is a separate cashier from the main cashier in the hospital. This is the one right outside the outpatient department. Go to the cashier. They add it all up. I'm paying for the syringes, 2 syringes. I'm paying for the cotton balls, 2 Band-Aids, and him physically giving me the shots. And my God, the cost, this was, I need to have a PayPal for this. I need to run a donation for this, a GoFundMe. It was 252 pesos for that. So that's the lab guy giving me the shot, 2 syringes, 2 cotton balls, and 2 Band-Aids. So now we're at 3,252 pesos for everything. We go back in, and the nurse tells me, you have to come back when we get the results to your blood test. And I'm supposed to go get the results and bring it to them. We ride home, and it's 5 o'clock in the afternoon. And we started this journey about 1:30 in the afternoon. So this isn't too bad for us riding our motorbike from Valencia to Silliman Hospital and back home. And we're home around 5 o'clock. I call a friend and say, hey, I've been in the hospital today. And we talked about what was wrong with me and what did I think it was. Because I haven't gotten an exact answer yet from the hospital on what my problem is. They're waiting on the blood work, the results from the blood test. And we start talking about this, and it makes sense. The first time I had this small infection, I got cut, and then I took a shower. And this is city water. This is not the water you drink. Again, it's in Cebu, but it's not, the best water. And when we got home to Dumaguete, it was still open sore. And when I took a shower, the shower water would get on there, and I was out in the rain. and water would get on this open wound. I didn't have it covered well. I'm not really good at doing that stuff. I'm really lazy. So could it have been the water having some sort of parasite getting in there and causing the infection? When I got the second one, the one that caused me to go to the emergency room, it bled when I was in the shower. And that day when I was out, I also got caught in the rain. I was down at Bo's Coffee and I was leaving to head home, and it was raining. The storm just ended, but it was still raining. My arm got wet, my shirt got wet. And I got home and it was just worse than it was before. And that caused me to go down to the hospital. So is that possible? Parasites get into an open wound? Other people have told me it's possible that if you have an open wound on your leg or your ankle and you're out in the rain and that, the rainwater or street water gets into the wound, you can get these parasites that get there and can cause you some problems and infection and issues. So this is hitting me now. Is this something that I caused myself by washing it in not sterile water? What? I didn't use bottled water to wash the wound. I used the shower water, the tap water. So when I went back at 8 o'clock to get my blood results and go see the doctor, now the OPD is open 24/7. It's connected to the emergency room, the outpatient department. I went in there, I handed them the test results, and I waited. I waited an hour for them to finally come and check with me. But they have other patients. It's like a triage. They're going to treat people with more serious injuries than me. There was a child ahead of me who had something wrong with its foot and had to get a shot. And I fully, understand it's not first come, first serve an emergency room situation. It is the most in need to be taken care of first. And they're always going to take care of the elderly and the infant children way ahead of a mature man who has just got an infection in his arm. My arm's not going to fall off, even though Janet said they should have just cut it off. That way I don't have any problems. When it was my turn, she described herself as an intern, and she told me I had an infection and gave me prescriptions for more medication. The grand total of pills I got 3 different types of pills. One was an antibiotic, another one was a pain pill, and another one was a different type of antibiotic that I took once a day. There were 28 pills of blue pills antibiotic. There were 5 pills of a different type of antibiotic and 6 pain pills. And I went over to the pharmacy to get this filled. Now, this is a ridiculous amount of money I had to pay here. It took about a half hour for them to fill it. It's after hours. They're closed. They have this little express lane or single door that goes to the pharmacy at Silliman. And, there were like 3 people ahead of me. I had to wait my turn. When they were all said and done, it was 1,820 pesos for the medication there. So I was at 3,252. And now you add another 18. So I'm at 4. I'm a little bit over 5,000 pesos with all the medication, the office visit, the doctor's visit. And I asked them in the outpatient department when they were putting all my paperwork together, I said, did I pay for the doctor consultation? And they go, yes. It was part of that 1,030 that I paid earlier at the hospital. And that went for the lab work and the consultation with the doctor. So all in all, I got all this taken care of for 5,000 pesos, just a hair over 5,000 pesos. And I was home by 10 o'clock. So this is not too bad. 8 hours total from 2 o'clock until 10 o'clock with the 3-hour break. I was at home from 5 p.m. until 8 p.m. And the visit to the hospital, being at Silliman, not a public hospital. This is a private hospital. Me and Janet stopped and got extra money. When I was going the first time, we went to the ATM. We took out a lot of money and we had it in a little pouch. And I was ready to pay 10,000, 20,000. I don't know what their fees are or what they're going to charge. You hear horror stories of how they're not going to take care of you unless you have X amount of money up front. I didn't know what I had. Could it have been something serious? It was serious enough for me to drive down there and get it checked on. I'm one of these guys. It takes a lot to get me to the doctor. It takes even more to get me to the hospital. So all in all, I want to just say a lot of people who have small injuries, they show you a sprained ankle or they fell off their motorbike and they got a sprain, even a broken bone. It isn't that much to get it looked at and taken care of. The biggest expense in medical here is if you're put into the hospital. If you become a patient in the hospital, the daily expenses can add up. Doctors are very cheap here. Not that their quality of care is cheap, but they just don't charge a lot, thank God. It's like attorneys here. We bought that property and our attorney is 25,000 for the whole process of getting us the title. This is months and months of work, under $500 for an attorney. And here we're seeing doctors for 700 pesos was the consultation with the doctor. What is that? $13? My God, it's so cheap. And there really was no emergency room fee using the outpatient. Now, if I came in an ambulance and I'm in a gurney and they take me into the other door of people who are much worse condition, maybe a heart attack, stroke, or something this nature, and they need to send you upstairs into the hospital for some major care and major medical testing and work done to you, yes, you probably need more money. But for minor things, everyday nicks and cuts and sprains and broken bones, normal things that happen in the course of life here in the Philippines, those things seem to be really cheap to take care of. It's the catastrophe. It's the major medical that you have to worry about and its cost. Hopefully, I never find out what those cost. We've heard rumors when other people have gone to the hospital and they've passed the extraordinary amount of money they need just to get out of the ambulance, to get admitted into the hospital. These are nightmare scenarios. Guys, you always need to have access to money. A good debit card or a good credit card works, but there's nothing like cash here in the Philippines. Thank God my injury, it's all healed now. The swelling is down to minor and the medicine is doing great. It was the initial tetanus shot and antibiotic shot that did the trick. These other pills are just a follow up and keeping some antibiotics in my system. The nurse said it wasn't sepsis, but it is from dirty water getting on an open wound. So, guys, if you got an open wound and you go out in the rain or you step in these puddles everywhere, guys, don't wear your flip flops outside, sandals, stay out of these water puddles. The dogs and critters around the road, all this stuff, it gets washed down into these puddles. And if you're standing somewhere and the water gets splashed on you, make sure you keep your open wounds covered, put a Band-Aid over them, maybe even a plastic bag and tape it up, just to keep yourself safe. These little parasites here in the Philippines, they can cause havoc with your insides with diarrhea and fever. They also can cause havoc if they get inside a wound and it swells and you get a bad infection. Sepsis is really something not to mess around with. I've had co-workers in the States have that, and I've seen them in pain and in the hospital for weeks until they were healthy enough to come back to work. Take care of yourself. I was shocked at the low cost of medical service, and that was Silliman Hospital. It wasn't the local public hospital. It was a private hospital. Guys, until next time, stay safe and keep those cuts covered.